You know that feeling when you get a blood test report back and it just looks like a bunch of confusing numbers and abbreviations? Well, today we are going to crack the code on one of the most common, most important tests out there, the complete blood count. We're going to show you how to read the secret story that your blood is telling.
Seriously, what if a single drop of your blood could tell a whole story about your health? You know, a story with a full cast of characters, clues, and plot twists that doctors use to see what's really going on inside your body. Well, that's exactly what a CBC does.
So what is this thing? It's the complete blood count, or CBC for short. And really, it's just a snapshot of the three main players in your blood: your red cells, your white cells, and your platelets. Think of it like a daily intelligence briefing from the front lines of your body's health.
All right, first up, let's meet the first character in our story, the red cell oxygen crew. These guys are the tireless delivery workers of your bloodstream. Their whole story is about energy and transport.
So just look at this. This is the incredible journey of a single red blood cell. It all starts in your bone marrow as a stem cell, and as it grows up, it completely transforms. And get this, it actually ditches its own nucleus just to make more room for its precious cargo, oxygen. Its entire purpose, its whole reason for being, is to be the perfect delivery truck, picking up oxygen in your lungs and dropping it off to every single cell in your body.
So how do we keep tabs on this oxygen crew? Well, doctors look at three key numbers. First, the RBC count. That's simple, it's just how many red cells you actually have. Then there's hemoglobin, which is the special protein that physically grabs onto the oxygen. And finally, hematocrit, which tells you how much of your blood by percentage is made up of these hardworking red cells.
Now here's where it gets really interesting. Doctors are always looking for balance. If these numbers are too low, it can signal something called anemia, which might be caused by anything from not getting enough iron to more serious kidney issues. On the flip side, if the numbers are too high, a condition called erythrocytosis, it could point to something as simple as dehydration or something more complex like lung disease. It's really all about having the right size crew for the job.
Okay, but the story gets even deeper. See, it's not just about counting the workers. The CBC also gives a quality report. The size and the shape of your red blood cells, well, they provide a whole other layer of really crucial clues.
And this is a perfect look at what doctors are searching for under the microscope. Healthy red blood cells are pretty uniform, almost like identical twins. But when you start seeing a lot of variation, that's a red flag. They have these fancy words for it, like anicytosis, which just means lots of different sizes, and poikilocytosis, which means different shapes. Seeing this tells a doctor, I need to dig a little deeper here.
This is where the real detective work begins, because it's all about how these clues are combined. Let's look at a classic pattern. If the average cell size, that's the MCV, is low, meaning you've got small cells, and the size variety, the RDW, is high, that's a very strong clue for iron deficiency anemia. And it makes sense, right? The body is desperately trying to make new red cells, but it's missing a key ingredient, iron. So the new cells that manage to get made come out small and inconsistent, kind of like a factory running on empty.
But now, look at this. The cell size is still low, but the size variety is normal. What does that mean? It means all the cells are small, but they're uniformly small. This pattern points away from iron deficiency and suggests something else entirely, like thalassemia trait, which is a genetic condition. It's a perfect example of how two very similar clues, with one small difference, can lead to completely different conclusions.
All right, let's bring out our second character, the white cell defense force. These are the soldiers of your immune system. They are constantly on patrol, always ready to defend you from infections and any other invaders. Now, your immune army has all kinds of different specialists for different threats. You've got your neutrophils, they're the first responders, the infantry that rushes in to fight bacteria. Then you've got the lymphocytes. They're the specialists, the snipers who fight viruses and create antibodies. The monocytes, they're the cleanup crew, coming in after the battle to clear out the debris. And the others, eosinophils and basophils, they handle more specific threats like allergic reactions and parasites.
The total number of these white blood cells tells a huge part of the story. A low count, or leukopenia, might mean the immune system is overwhelmed by a virus, or maybe it's being suppressed by something like chemotherapy. A high count, leukocytosis, well, that's the classic sign that your body is calling in reinforcements and fighting back hard against an infection or inflammation.
Okay, pay attention, because this is one of the most important slides in this whole breakdown, especially if you're ever looking at a child's CBC. Normal is a moving target. Just look at this dramatic flip. In a newborn, neutrophils are the dominant force, but by 1 year old, the lymphocytes have taken over.
Then it flips back again in adulthood. This is exactly why a doctor always has to interpret a CBC in the context of a patient's age. On to our third and final character, the platelet repair team. These are your body's emergency responders. They're tiny, but they are the mighty crew that prevents you from bleeding out from something as simple as a paper cut.
So what exactly are platelets? Well, they aren't even full cells. They're just these tiny little fragments floating around. But their job is absolutely essential. The second a blood vessel gets damaged, they get an emergency signal, rush to the scene, and start sticking together to form a clot, literally plugging the hole.
And just like our other teams, you guessed it, balance is key. Too few platelets, a condition called thrombocytopenia, raises the risk of dangerous bleeding. That can be caused by viruses or certain autoimmune issues. Too many, or thrombocytosis, can be a reaction to inflammation or even iron deficiency, and that might increase the risk of dangerous, unwanted clots.
So, we've met our three main characters. We've got the oxygen crew, the defense force, and the repair team. Now, let's put it all together and talk about how to read the full story, not just a single chapter.
If you only take away one thing today, let it be this. A single abnormal number on a CBC report is just a clue. It is not a conclusion. A doctor never, ever looks at one value in isolation. They're looking at how all the numbers relate to each other, how they compare to your past tests, and how they fit in with you as a whole person.
So, let's just sum it all up. A CBC tells a story about those three main characters in your blood. Remember that what's considered normal can change a ton, especially with age. A single weird result is just a starting point, a clue, not the final answer. The real insights are often found in the patterns between the numbers. And of course, the most important thing, always talk through your results with a healthcare professional.
Look, a CBC isn't just a list of numbers to be scared of. It's a dynamic story about the incredible, amazing work that's happening inside you every single second of every day. And by understanding the basics of the plot and who the main characters are, you are so much more empowered to be an active participant in your own health journey. So now that you can read the story, what will you learn?